Joints can lose their function for a variety of reasons. Common causes include wear and tear from aging, previous injuries, repetitive stresses, obesity, genetic, autoimmune diseases, and muscle weakness. These factors can lead to symptoms such as pain, stiffness, swelling, instability, and difficulty performing daily activities. Understanding these causes is the first step in developing effective treatments and interventions to restore joint function and improve patient outcome. Joint function declines. Patients often experience pain, stiffness, swelling, instability, and weakness. These symptoms can make everyday tasks challenging. Initial treatments typically focus on non-surgical options such as physical therapy, low-impact exercises, weight management, and pain relief medications like NSAIDs. These approaches aim to reduce symptoms and slow the progression of joint degeneration, helping patients maintain mobility and independence for as long as possible. Joint degeneration is a complex process involving both mechanical and biological factors. Over time, chemical mediators can sensitize nerves, leading to heightened pain perception. This process is often visualized through medical imaging, which helps clinicians assess the extent of degeneration and plan appropriate interventions. Recognizing the signs of joint degeneration early is key to preventing further damage and improving long-term outcomes for patients. When conservative treatments are no longer effective, surgical interventions may be necessary. Less invasive surgeries focus on repairing or strengthening tissues or removing damaged parts of the joint. If the joint is still in relatively good condition, resurfacing techniques can replace just the surface of the bones with artificial components. In more severe cases, total joint replacement is performed, removing the damaged joint entirely and replacing it with artificial materials designed to mimic natural function. Total hip replacements have revolutionized orthopedic care. The gold standard, known as the Charnley low-friction arthroplasty, has been available since 1962. This procedure set the foundation for modern hip replacements, offering improved mobility and pain relief for countless patients. Over the decades, advancements in design and materials have further enhanced the success and longevity of these implants, making hip replacement one of the most successful surgeries in medicine. Total knee replacements have also seen significant progress. The first successful procedure is credited to Frank Gunston in 1968. Since then, numerous design and material innovations have expanded the options available to patients. These advancements aim to better replicate natural knee movement, reduce pain, and improve the durability of the implants, allowing patients to return to active lifestyles with greater confidence. Selecting the right material for joint replacements is critical. Ideal materials must have high wear and fatigue resistance, strength, adequate stiffness, and be chemically inert. They should also resist corrosion, be non-toxic, biocompatible, cost-effective, and manufacturable. These properties ensure that the implant can withstand the demanding environment inside the body while minimizing the risk of complications and maximizing longevity. A variety of materials are used in joint replacements, each with unique properties. Metals like cobalt, chromium, and titanium alloys offer strength and durability. Ceramics such as alumina and zirconia provide excellent wear resistance and biocompatibility. Polymers, especially ultra-high molecular weight polyethylene (UHMWP), are commonly used for bearing surfaces due to their low friction and good wear properties. The choice of material depends on the specific joint, patient needs, and desired longevity of the implant. Comparing ceramics, metals, and polymers, each has its strengths and weaknesses. Ceramics are extremely hard and wear-resistant but can be brittle. Metals are strong and durable but may be prone to corrosion. Polymers are lightweight and flexible but have lower wear resistance. The selection of materials is a balance between mechanical performance, biocompatibility, and the specific demands of the joint being replaced. Replacements can use different combinations of materials for the bearing surfaces. Common pairings include metal on polymer, metal on metal, ceramic on polymer, ceramic on metal, and ceramic on ceramic. Each combination offers distinct advantages in terms of wear, longevity, and risk of complications. The choice is tailored to the patient's age, activity level, and specific health needs to ensure the best possible outcome. Total hip replacement involves removing the damaged hip joint and replacing it with artificial components. This procedure restores mobility and relieves pain for patients with severe joint degeneration. The artificial joint is designed to mimic the natural movement of the hip, allowing patients to return to everyday activities with improved comfort and function. Advances in surgical techniques and materials have made hip replacement one of the most successful orthopedic procedures. Total knee replacement is a surgical procedure where the damaged knee joint is replaced with artificial components. This operation is typically recommended for patients with severe arthritis or injury that limits mobility and causes significant pain. The artificial knee is engineered to replicate the natural movement of the joint, helping patients regain function and enjoy a better quality of life. After hip replacement surgery, patients often experience changes in joint movement. There is typically an increased range of hip flexion, decreased extension, and a smaller pelvic tilt at maximum flexion. Restoring the center of rotation is essential for optimal function, as it ensures the correct lever arm for muscles and reduces the risk of complications such as dislocation or pain. Proper surgical technique is key to achieving these outcomes. Femoral offset, or the horizontal distance between the center of the femoral head and the shaft, plays a crucial role in hip stability. The abductor muscles, which stabilize the pelvis, rely on this offset for optimal function. A restored or increased offset provides a longer lever arm, enhancing muscle strength and reducing the risk of dislocation. Conversely, a decreased offset can weaken the muscles, leading to instability and increased implant wear. Recovery after total hip replacement is a gradual process. In the first 12 weeks, hip flexion is limited to less than 90 degrees, and internal rotation is avoided. After 12 weeks, patients can achieve greater ranges of motion, with full recovery and maximum joint function typically reached after about 2 years. Adhering to rehabilitation protocols is essential for a successful outcome and long-term joint health. Total knee replacement also brings changes in joint movement. Postoperatively, patients experience increased knee extension and improved range of motion during walking. Some prosthetic designs aim to increase the moment arm for the quadriceps, reducing the force required for extension. However, no implant perfectly replicates the natural kinematics of the knee, and ongoing research seeks to improve these outcomes. In natural knee, the rollback motion allows the femur to roll back on the tibia during flexion, reducing pressure on the kneecap. This is accompanied by the screw-home mechanism, which stabilizes the extended knee. Total knee replacements aim to replicate these motions, but no implant fully reproduces the complex kinematics of a natural knee. Some designs, like the Safe Knee, have shown promise in providing stability throughout the full range of motion. Recovery after total knee replacement is measured in degrees of motion. Immediately after surgery, patients may achieve 70-90 degrees of flexion. 1 month post-surgery, this increases to 95-115 degrees, and by 3 months most patients reach 109-122 degrees. Extension also improves over time, with most patients achieving full extension within a year. Rehabilitation is key to regaining strength and mobility. Bone is an adaptive material responding to the stresses placed upon it. According to Wolff's law, bone is laid down in regions of high stress and removed in regions of low stress, a process known as bone remodeling. This principle is crucial in orthopedics, as implants must be designed to encourage healthy bone adaptation and prevent complications such as stress shielding and bone loss. There is a major concern in joint replacements, as it can lead to the generation of debris that causes inflammation and bone loss. Advances in materials and design aim to minimize wear and extend the lifespan of implants. Regular monitoring and early intervention are essential to address wear-related issues before they compromise the function of the joint replacement. Despite advances in technology, some joint replacements require revision surgery. The most common reasons include aseptic loosening, infection, pain, instability, wear of components, osteolysis, misalignment, stiffness, dislocation, and fractures. Understanding these failure modes helps clinicians improve surgical techniques and implant designs to reduce the need for revision procedures. Septic loosening is a leading cause of implant failure. It occurs when the bond between the implant and bone weakens, often due to excessive wear, stress shielding, or micromotion. Strategies to prevent aseptic loosening include using stiff materials, optimizing implant design, and minimizing wear debris. Early detection and intervention are key to preserving joint function and avoiding revision surgery. Size of the femoral head in hip replacements affects wear and stress distribution. Larger heads provide more even stress distribution but require thinner cups, which can increase contact stresses. Smaller heads reduce wear but may limit range of motion. Engineers must balance these factors to optimize implant performance and longevity for each patient. Wear rate in hip replacements can be estimated using clinical radiographs and mathematical models. Excessive wear generates millions of tiny particles, which can trigger osteolysis, progressive bone destruction. Keeping wear rates low is essential to prevent complications and extend the life of the implant. Minimize wear and aseptic loosening. Several strategies are employed. These include using stiff materials, selecting appropriate head sizes, and improving the sliding properties of bearing surfaces. Joint resurfacing techniques, which preserve more of the patient's natural bone, are also gaining popularity for their potential to reduce wear and support quicker recovery. Metal-on-metal hip replacements offer a significant reduction in wear rate compared to metal-on-polymer designs. However, they require precise manufacturing tolerances and may produce metallic debris, which can trigger biological responses. The choice between these materials depends on patient factors and the specific demands of the joint replacement. Ceramic-on-ceramic hip replacements have demonstrated excellent long-term results, with low revision rates and high patient satisfaction. These implants offer a high range of motion and are particularly beneficial for patients who require flexibility, such as those in cultures where floor-seated positions are common. Ongoing research continues to improve the performance and reliability of ceramic implants. While most patients experience significant improvements after joint replacement, satisfaction rates can vary. Studies report dissatisfaction rates of 20% to 40%, often due to abnormal joint kinematics or feelings of instability. Ongoing research aims to better understand and address these issues, ensuring that implants not only last but also meet patient expectations for comfort and function. Joint registers are invaluable resources for tracking the performance of different prostheses, causes of failure, and rates of revision. By analyzing large datasets, clinicians and engineers can identify trends, improve implant designs, and refine surgical techniques. This evidence-based approach is essential for advancing the field of orthopedic biomechanics and ensuring the best possible outcomes for patients.